Hi guys, I'm Mahendran from BPT second year National College of Physiotherapy, which is in Coimbatore. Okay, let's move on our article. What is article? It's a cerebral palsy. My article is cerebral palsy. Okay, what is cerebral palsy? Cerebral palsy is group of disorders that affect movement and muscles, tone or posture. It is caused by damage that occurs to the immature developing brain and before birth. Signs and symptoms appear during infancy or preached years. In general, cerebral palsy causes impaired movements associated with exaggerated reflexes and floppiness are separately our limbs and trunks. Unusual posture, involuntary movements, and steadily walking are some combination of these causes. Cerebral palsy is caused by abnormal brain development or damage to the developing brain. That usually happens before the burns, but it occurs birth or yearly bleeding into brain in wombs or new impairment. Symptoms. What are the symptoms? The signs and symptoms of cerebral palsy can vary greatly from person to person. Cerebral palsy can affect the whole body or might be limited primarily to one or more limbs or one side of the body. Generally, signs and symptoms include problems with movement and coordination, speaking and eating development and other problems. Okay, movement and coordination, stiff muscles and exaggerated reflexes, most common movement disorder, variation in muscles tone such as being either too stiff or floppy, stiff muscles with normal reflexes, lack of balance and muscle contraction, tremors or jerky movements and slow withing movements, delay speech movement, difficulty speaking, difficulty with sucking, chewing, eating, excessive rolling, and problems with swallowing. Complication. What are the complications for cerebral palsy? Cerebral palsy. Movements weakness, muscle spasticity, and coordination problems can contribute to the number of complications either during childhood in or adulthood, including the contraction in muscle tissue shortening and due to several muscles tightening and can be result of spasticity. Prevention. What are the prevention for cerebral palsy? Most causes of cerebral palsy can't be prevented, but you can be reduced risk if you pregnant or planning to become pregnant. You can be take these steps to keep healthy and maintain pregnancy complications. Make sure you are vaccinated. Getting vaccinated against disease such as rubella, preferably before getting pregnant, might prevent to infection that cause fetal brain damage. Okay, what are the diagnosis and treatment for this cerebral palsy? The brain scans. The brain imaging technology can reveal areas of damage or abnormal development in brain. The tetra might include the following. MRI. An MRI uses radio waves and magnetic field to produce detailed 30 or cross-sectional images of this brain. An MRI can often identify test and abnormality in your childbirth. This test is painless. It is called as cerebral palsy. These are the complications of cerebral palsy. Okay, thank you for giving me this wonderful opportunity. Thank you.